A study that came out just 3 weeks ago is about to change everything you think you know about blood pressure. If you're over 65, if you're taking blood pressure medication right now, if your doctor told you, we need to get you down to 120/80, then what I'm about to share could be the most important health information you hear this year, because researchers tracked over 15,000 seniors for 5 years, and what they discovered should have been front-page news in every newspaper in the country. But it wasn't. Most doctors haven't seen it, most patients have never heard of it, and what they found is this. For adults over 75, having that so-called perfect blood pressure of 120/80 increased their risk of dangerous falls by 28%, increased their risk of kidney damage, and here's the part that's going to shake you. It actually increased their risk of dying. The people who lived the longest, their blood pressure was higher, not lower, higher. Now I know that sounds like it contradicts everything you've been taught, everything your doctor has told you, everything you've read in every health pamphlet in every waiting room for the last 30 years. And I'm not going to ask you to just take my word for it. I'm going to walk you through exactly what this research found, step by step, number by number. I'm Dr. Ryan Mitchell. I've spent 22 years in cardiovascular medicine, and in the next 18 minutes, I'm going to show you 3 things. First, why the blood pressure target your doctor is using was never designed for people your age. Second, the simple 3-minute test you can do in your own bedroom tonight that could prevent a life-ending fall. And third, I'm going to give you the exact blood pressure range, broken down by age, that research now links to the longest, healthiest life in older adults. But I'm not going to reveal that number yet, because if I tell you the number right now, some of you will write it down and click away. But the number without the understanding is dangerous. You need to know why this number is different for you. You need to see what happens when doctors chase the wrong number. You need to hear what happened to a man named James, because James's story will change how you think about blood pressure forever. And once you understand what happened to James, that number will make perfect sense, and it will save your life. But first, I need something from you. Drop a comment right now. Just 2 things. Your age, and how many blood pressure medications you're currently taking. That's it. Just something like 74, 2 medications, or 68, 1 medication, or 81, 3 medications. I need to see who's watching because what I'm about to explain applies differently depending on whether you're 65 or 85, and the number of medications you're on tells me something critical about your risk level. You'll understand why in about 4 minutes. Let me tell you about James. James was 76 years old, retired teacher, loved woodworking in his garage. Every morning he'd walk to the end of his street and back, not a marathon, just a quiet walk. He called it his thinking time. James was independent, sharp, happy. When James turned 68, his doctor noticed his blood pressure was 154/90. Too high, the doctor said. We need to bring that down. Started James on 1 medication. 2 months later, 140/84. The doctor nodded. Getting better, but we're not at goal yet. We need 120/80. That's the gold standard. Increased the dose, added a second pill. 3 months later, James was at 126/78. Almost there, the doctor said. Adjusted the second medication upward. By the time James was 72, his blood pressure was 118/74. His doctor was thrilled, shook his hand. Perfect numbers, James. This is exactly where you should be. You're doing everything right. James felt proud. He was doing everything right. Taking his pills every morning, checking his numbers at home. 118/74, like clockwork. But then something started happening. Something small. Something James almost didn't notice at first. When he stood up from his workbench in the garage, the room would go gray for a second. Just a flicker. Like someone dimmed the lights and turned them back on. He'd steady himself against the bench and it would pass. He mentioned it to his wife. She said, drink more water. He mentioned it to his doctor at the next visit. The doctor barely looked up from the computer. That's normal at your age. Blood vessels get slower. Just stand up gradually. Take your time. So James stood up slowly, very slowly, like a man afraid of his own body, and the gray flickers kept happening, every single time he stood, every time he got out of bed, every time he rose from the dinner table. His wife noticed he was gripping furniture when he walked. She noticed he stopped going to the garage as often. She noticed he started sitting down more and moving less, but his blood pressure was perfect, 118/74. What could possibly be wrong? Then came the morning that changed everything. James woke up at 3 a.m., needed the bathroom. He sat up in bed, swung his legs over, stood up. The room didn't just go gray, it went black. James felt his knees give way. He reached for the nightstand. His fingers brushed it but couldn't grip. He went down hard. His left hip hit the floor first, then his shoulder. Then his head cracked against the baseboard. His wife woke to the sound of the impact. Found James on the floor, conscious, terrified, unable to move his left leg. The pain in his hip was blinding. She called 911. At the hospital, the paramedics had already checked his blood pressure 3 times. Lying in the ambulance, 116/72. Fine on paper. Sitting up, 92/60. Standing. They couldn't get a standing reading because James couldn't stand. That gap, that drop from 116 lying down to 92 sitting up, that's a 24-point collapse. James's brain had been starving for blood every single time he stood up. For years. And nobody had checked. The diagnosis, fractured hip, complete break, required emergency surgery. James was 76. Surgery at 76 is not the same as surgery at 46. The anesthesia hit harder. Recovery was brutal. He spent 9 days in the hospital, developed a urinary tract infection, then was transferred to a rehabilitation facility for 4 weeks. 4 weeks of learning to walk again, physical therapy twice a day. A man who'd been walking to the end of his street every morning now struggled to get from the bed to the bathroom with a walker. James finally went home. But the James who came home was not the James who left. He was afraid. Afraid of standing, afraid of falling again, afraid of the dark because that's when he fell. He stopped going to the garage, stopped his morning walks, stopped wanting to leave the house. His world shrank to 3 rooms: bedroom, living room, kitchen. And even in those 3 rooms, he moved like a man walking on ice. 4 months after the fall, James developed a blood clot in his leg. Deep vein thrombosis. From all that sitting, all that not moving, all that fear, the clot traveled to his lungs. Pulmonary embolism. James died in the emergency room. He was 76 years old. His blood pressure at the time of his fall had been 118/74. Perfect. By the textbook. Perfect. His daughter told me later, Dad's doctor was so proud of those numbers. 118/74. He said Dad was doing better than most people half his age. But those numbers killed my father. How does a perfect number kill someone? That question, that exact question, is why I'm making this video. Now I need you to do something right now. If you ever get dizzy when you stand up, if the room ever goes gray or spins for a moment when you get out of a chair, get out of bed, get up from the couch, I need you to type 1 word in the comments. Just 1 word. Dizzy. Type dizzy right now, because if this is happening to you, you are experiencing the exact same warning sign that James ignored for years. The same sign his doctor dismissed as normal aging. It's not normal. It's a red flag. And in a few minutes, I'm going to show you exactly what to do about it. Why 120/80 was never meant for you. So how does a perfect number kill someone? To understand that, you need to understand something your doctor may have never explained to you. And honestly, it's something many doctors don't fully think about when they're prescribing blood pressure medications. Your body at 75 is not just an older version of your body at 45. It is a fundamentally different machine. And a fundamentally different machine needs fundamentally different settings. Let me walk you through the 3 changes that happen inside your body as you age, and why each one makes the standard blood pressure target potentially dangerous. Change number 1, your arteries harden. When you were young, your arteries were like fresh rubber bands, stretchy, flexible. Every time your heart pumped, those arteries would expand, absorb the pressure, and then gently push the blood forward. Beautiful system. But over decades, those arteries stiffen. They lose their stretch. Think about an old garden hose that's been sitting in the sun for 20 years. You turn on the water and instead of expanding gently, it's rigid. The water blasts through harder because the hose can't flex. That's what happens to your arteries. The medical term is arteriosclerosis. And here's the critical part. When your arteries are stiff, you need slightly more pressure to push blood all the way up to your brain, especially when you're standing upright and gravity is pulling blood downward toward your feet. A young person with flexible arteries can maintain perfect brain blood flow at 120/80. An older person with stiff arteries might need 135 or 140 to achieve the same blood flow. If you force that older person down to 120, their brain isn't getting what it needs. Change number 2. Your internal pressure sensors slow down. You have tiny sensors called baroreceptors inside your blood vessels. Think of them like the thermostat in your house. When you stand up, blood naturally drops toward your legs. Your baroreceptors detect this pressure drop instantly, within milliseconds, and they send an emergency signal. Heart, pump harder. Blood vessels, squeeze tighter. Maintain pressure to the brain. In a young person, this happens so fast you never notice. You stand up, pressure adjusts, you're fine. But as you age, these baroreceptors get sluggish. They're like an old thermostat with a delay. You stand up, pressure drops, and instead of adjusting in milliseconds, your body takes seconds. 5 seconds, 10 seconds, sometimes 15 seconds. That delay, that's the gray out, that's the dizziness. That's the moment James's knees buckled. His baroreceptors couldn't respond fast enough. And because his baseline pressure was already low, that so-called perfect 118, there was no safety margin, no buffer. When the drop happened, his brain went dark. Change number 3. Your body processes medications differently. Your kidneys and liver are the organs that break down and clear medications from your blood. At 45, they work at full speed. A blood pressure pill gets processed efficiently. The dose your doctor prescribes produces a predictable, manageable effect. But by 75, your kidneys are working at maybe 60 to 70% capacity. Your liver isn't as fast. That same dose of medication now lingers longer, hits harder, stays in your system hours longer than it would in a younger person. So a dose that's perfect for a 50-year-old can be an overdose for a 78-year-old. Not a dramatic, obvious overdose. A quiet one. A slow one. The kind that shows up as dizziness you learn to live with. As fatigue you blame on aging. As a gray out when you stand that you tell yourself is just getting old. But it's not getting old. It's your medication pushing your pressure below what your aging body needs to function safely. And nobody is checking. Now let me show you what the researchers discovered, because the specifics are what make this impossible to ignore. The study I mentioned at the beginning was published in the Journal of the American Medical Association, one of the most respected medical journals in the world. They followed 15,142 adults over 75 years old. Not handpicked, healthy volunteers living perfect lives. Real people. People with diabetes. People who'd had strokes. People with heart disease. People with kidney problems. People with arthritis. People who used walkers. People in wheelchairs. The full spectrum of what it means to be over 75 in the real world. They tracked these people for 5 years, monitored their blood pressure, recorded what happened to them. Falls, hospitalizations, strokes, heart attacks, kidney problems, death. Then they grouped everyone by their average systolic blood pressure, that's the top number, and compared outcomes across groups. Group 1, systolic below 120. The perfect group by traditional standards. Group 2, systolic 120 to 130. Group 3, systolic 130 to 140. Group 4, systolic 140 to 150. Group 5, systolic above 150. Now, here is what they found, and this is the part I need you to really hear. The group that lived the longest, the lowest death rate, the fewest hospitalizations, the best quality of life, was not the group below 120. It was Group 3, systolic between 130 and 140. The group below 120, the group that had achieved what every doctor in America calls perfect, had a 28% higher risk of serious falls, higher rates of acute kidney injury, higher rates of fainting, and their overall death rate was 14% higher than the 130 to 140 group. Let me say that again because it matters. The people with perfect blood pressure died at higher rates than the people whose blood pressure was what most doctors would call too high. Now, the group above 150 also had problems. More strokes, more heart attacks, more cardiovascular events. That's expected. Chronically high pressure does damage. But here's the surprise that rocked the research community. Very low pressure was just as dangerous as very high pressure. Both extremes killed people. The safest place to be wasn't at the bottom. It was in the middle. And that middle, that sweet spot, was higher than what conventional guidelines recommend for almost everyone. Now, if what I've shared so far has opened your eyes, if you're starting to see your own blood pressure situation differently, I need you to do 2 things right now. First, hit subscribe and tap the bell. Because my mission with this channel is bringing you research that's sitting in medical journals. Research that could change your life. But that takes years to filter down to your doctor's office. I'm closing that gap. Every week. and you need to be here for it. Second, think of one person you love who's over 65 and taking blood pressure medication. Your spouse, your parent, your neighbor, your friend from church, and share this video with them right now. Send them the link. Don't wait until after the video. Do it now. Because what I'm about to show you next, the home test and the real target numbers, could literally prevent the fall that starts the cascade. The fall that started James's cascade. Share it now. You could be saving someone's life today. Now I know what you're thinking. Just tell me the number already. What should my blood pressure be? I'm going to tell you. I promise. And it's coming soon. But there's one more thing you need to see first. Because knowing the target number is only half the battle. There's a hidden danger that the number alone won't protect you from. A danger that killed James even though his lying down blood pressure looked perfect. The hidden danger is what happens to your blood pressure when you move, when you stand, when you change positions. And there's a test, a simple test you can do at home tonight, right in your bedroom, that can tell you whether your blood pressure medications are secretly putting you at risk. This test takes 3 minutes, it costs nothing, and it reveals something that most doctors aren't checking for at your regular visits. Here is the test. It's called an orthostatic blood pressure measurement. Let me walk you through it step by step. You need one thing, a home blood pressure monitor. If you don't have one, you can get one at any pharmacy for about $25 to $30. It's one of the best investments you'll ever make in your health. Step 1. Lie down flat on your bed or your couch. Get comfortable. Set a timer for 5 minutes. Just rest. Don't talk. Don't look at your phone. Let your body settle. Step 2. After 5 minutes, while you're still lying down, check your blood pressure. Write down both numbers. The top number, systolic. The bottom number, diastolic. Write them on a piece of paper. Don't try to remember them. Write them down. Step 3. Now stand up. Not slowly, not carefully. Stand up the way you normally would if you were getting out of bed to go to the bathroom. Naturally. Step 4. Immediately check your blood pressure again. Right away. While standing. Don't wait 2 minutes. Don't sit down first. Check it standing, as quickly as you can get the cuff on. Step 5. Write down those numbers next to the lying down numbers. Now compare them. Here is what you're looking for. If your top number, systolic, dropped by more than 20 points, that's a red flag. If your bottom number, diastolic, dropped by more than 10 points, that's a red flag. Let me give you a real example so this is crystal clear. Let's say lying down, your blood pressure is 128/78. That looks wonderful. Textbook. Your doctor would be delighted. But when you stand up, it drops to 100/64. That's a 28-point drop in systolic. That is dangerous. That means every single time you stand up, your brain is losing blood flow. You are one stumble away from a fall that could change your life. James's numbers? Lying down, 116/72. Sitting up, 92/60. A 24-point drop. And nobody checked. Not once in 4 years of those perfect readings. This is the test your doctor should be performing at every single visit if you're over 70 and on blood pressure medication. If they're not doing it, you now know how to do it yourself. Do it tonight. Write down the results. Bring them to your next appointment. Now, after you do this test tonight, and I want you to promise me you'll do it, come back to this video and leave a comment with your results. Write it like this. Lying, your numbers. Standing, your numbers. Drop, the difference. For example, lying, 134/80. Standing, 112/68. Drop, 22 points. I read these comments. I need to see what people are finding. Because I believe when thousands of you do this test, the results are going to shock you. And they're going to prove exactly what this research is showing. Now, before I give you the actual target numbers, I need to show you why there's no single number that fits everyone. And the best way to show you is with 2 people who walked into my office the same week. The first was Dorothy, 79 years old. Dorothy had diabetes. She'd had a minor stroke 2 years earlier, mild kidney disease. She walked with a cane. Her blood pressure was 152/88. Her previous doctor had been trying to push her down to 120/80 for 3 years, put her on 3 medications, got her to 124/76. Dorothy was miserable, dizzy every time she stood, exhausted by noon, had fallen twice, once in the bathroom, once in the kitchen. Hadn't broken anything yet, but it was only a matter of time. I checked her orthostatic pressure. Lying down, 124/76, standing, 90/58, a 34-point systolic drop. Her brain was being starved every time she was upright. We pulled back her medications, carefully, one adjustment at a time, let her pressure come up to 142/82. Rechecked orthostatic, lying, 142/82, standing 126/74. Only a 16-point drop, safe range. The dizziness stopped. The fatigue lifted. Dorothy started walking to her mailbox again, started cooking her own meals again. Her previous doctor called me, upset. 142/82 is too high for a diabetic, he said. But Dorothy wasn't falling anymore. Dorothy wasn't afraid of her own bathroom anymore. Dorothy was living again. And 142/82 in a 79-year-old with her specific conditions was far safer than 124/76 with a 34-point standing drop. We were treating Dorothy, not a number. The second person that same week was Robert, also 79. But Robert was a different story. Healthy, active, played pickleball 3 times a week. No diabetes, no heart disease, no kidney problems, sharp as a tack. Blood pressure, 152/88. Same number as Dorothy. For Robert, 152/88 warranted attention. Not panic, not 3 medications, but attention. We started with lifestyle changes, less sodium, more potassium-rich foods like bananas, sweet potatoes, leafy greens, added a daily 30-minute walk on top of his pickleball. 3 months later, 138/82, no medication, no side effects, no dizziness. Robert felt great. His regular doctor wanted him on medication anyway. 138 is still above guideline, the doctor said. I disagreed. For a healthy, active 79-year-old with no other conditions, 138/82 with no orthostatic drop is a perfectly safe place to be. The risk from the pressure itself was minimal. The risk from medication side effects, dizziness, falls, fatigue, was real. Same age, same starting blood pressure. Completely different targets, completely different approaches. Because Dorothy and Robert aren't numbers on a chart. They're people. With different bodies, different conditions, different risks. This is what treating the patient, not the number, actually means. And then there was Helen. Helen is the story that keeps me up at night. Because Helen shows what happens at the other extreme. Helen was 84, frail, heart failure, severe arthritis in both knees, used a walker, lived alone, fiercely independent. Blood pressure, 164/90. Her doctor wanted aggressive treatment, 3 medications, target, below 130. Helen came to me for a second opinion. I looked at her chart. I looked at Helen, and I said something her doctor never said. Helen, for you, 164/90 might be exactly where your body needs to be right now. She stared at me. But my doctor says it's dangerous. What's more dangerous for you right now, I told her, is a fall. If we push your blood pressure down with 3 medications, you're going to get dizzy. You're going to get weak. And with your knees and your walker, 1 fall could mean you never walk again. We compromised. 1 low-dose medication brought her down to 152/86, checked orthostatic, only a 12-point drop. Safe. Helen tolerated it well. Helen is 88 now. Still independent. Still using her walker. Still in her own home. Blood pressure sits around 148/155, higher than any textbook would recommend. But Helen is alive. Helen is independent. Helen didn't fall. Helen didn't fracture. Helen didn't end up in a nursing home. If we'd pushed her to 120/80, I don't believe she'd be here today. Now I want to know where you fit. Comment one of these categories right now. Comment healthy and active if you're over 65 with no major health problems. Comment some conditions if you have diabetes, heart disease, or kidney disease. Comment frail and careful if you use a walker, have trouble with balance, or consider yourself frail. I need to see what my audience is dealing with, because the target I'm about to give you depends on which of these categories you fall into. Your actual blood pressure target. All right, you've been patient. You've earned this. Here are the blood pressure ranges that research now associates with the longest survival and best quality of life in older adults. Remember, these are guidelines based on the latest evidence. Your individual target should always be determined with your doctor based on your complete medical picture. But these give you a starting point for that conversation. A conversation most people never get to have because they don't know this information exists. If you're 65 to 74, generally healthy and active, research suggests a systolic target of 130 to 140, diastolic between 70 and 85, This is already higher than the old 120/80 standard. It gives your aging arteries enough pressure to deliver blood to your brain while still protecting against cardiovascular damage. If you're 75 to 84 and relatively healthy, the evidence supports a systolic range of 135 to 145, diastolic 70 to 85. This accounts for your stiffer arteries and your slower baroreceptors. You need that extra cushion, that extra buffer. If you're over 85 or if you're frail at any age, a systolic range of 140 to 150 may be most appropriate, diastolic 70 to 85. At this stage, preventing falls and maintaining independence takes priority over chasing a textbook number. Every point of unnecessary blood pressure lowering increases your fall risk. If you have diabetes, prior stroke, or heart disease, regardless of age, you need a carefully individualized target, usually in the 130 to 140 systolic range, not as low as 120, low enough to offer protection, high enough to prevent the orthostatic drops and medication side effects that cause falls. And here's something crucial that almost nobody talks about. Your diastolic pressure, the bottom number, should generally stay above 65. If it's consistently below 60, your heart muscle itself isn't getting enough blood flow during the relaxation phase. That's a problem even if your systolic looks fine. If your diastolic is regularly below 60, bring that to your doctor's attention. 26. The brain connection. Why this isn't just about falls. And I need to tell you about one more thing, because most people don't know about this and it frightens me. When blood pressure is too low in an older adult, it doesn't just cause dizziness and falls, it reduces blood flow to the brain. Consistently, over months and years. Your brain sits at the top of your body. Blood has to travel upward against gravity to reach it. When pressure is adequate, blood flow is strong. Your brain gets the oxygen and glucose it needs to think clearly, to remember things, to process information. But when pressure is chronically too low, even slightly too low, blood flow to certain brain regions decreases. Not dramatically. Not enough to cause an obvious stroke, but enough, over time, to contribute to something that terrifies every senior more than almost anything else. Cognitive decline, memory problems, foggy thinking, difficulty concentrating. Some researchers are now asking a deeply uncomfortable question. Are we accelerating dementia in some seniors by lowering their blood pressure too aggressively? The evidence isn't conclusive yet. Studies are ongoing, but the early findings are concerning enough that several major research teams are investigating. Here's what we do know. Seniors with very low blood pressure show reduced blood flow to certain brain regions on imaging studies. Seniors with moderate blood pressure, that 130 to 145 range, show better cognitive function than those below 120. And seniors who experience repeated episodes of orthostatic hypotension, those dizzy spells when standing, have higher rates of cognitive decline over time. If there's even a possibility that overly aggressive blood pressure treatment is contributing to cognitive decline in older adults, we need to rethink our approach. And the research is telling us to rethink it. Now you might be wondering, if this research exists, why hasn't my doctor told me? Why is my doctor still pushing for 120/80? The answer isn't that your doctor is bad. It's that the system is slow. Medical guidelines are based on large clinical trials. The landmark trials that established 120/80 as the target were done primarily in middle-aged adults, people in their 40s and 50s. When those results came out, the target was applied to everyone, every age, every condition. One number fits all. There was an assumption that turned out to be wrong, that what's good for a 50-year-old must also be good for an 80-year-old. Over the past decade, researchers started looking specifically at older adults. And they're finding that one size does not fit all. But it takes 5 to 10 years for new research to change official guidelines, and even longer for those guidelines to change daily practice in doctors' offices. Your doctor has 15 minutes per appointment. They're seeing 30 patients a day. They're following the guidelines they were trained on. And those guidelines haven't caught up to the research yet. This isn't about blame. It's about a gap. A gap between what we now know and what's actually happening in clinical practice. And you are the one who can close that gap by being informed, by bringing this information to your doctor, by asking the right questions. So here's exactly what I want you to do, starting tonight. Action 1. Get a home blood pressure monitor if you don't already have one. This is non-negotiable. You need to know your own numbers, not just the one reading at the doctor's office, your real, daily, average numbers. Action 2. For the next 2 weeks, check your blood pressure twice a day, Once in the morning before your medications, once in the evening. Write every reading down. Morning and evening, same arm, same position, sitting quietly for 5 minutes before you check. This gives you your true average. Action 3. Tonight, do the orthostatic test I showed you. Lie down 5 minutes, check pressure. Stand up, check immediately. If your top number drops more than 20 points or your bottom number drops more than 10, write those numbers down in red. Circle them. That is critical information for your doctor. Action 4. Be honest about your symptoms. Write them down. Dizziness when standing, how often, how severe, fatigue, trouble concentrating, brain fog. These are not just aging. These may be signs your blood pressure is being pushed too low. Your symptoms matter. Action 5. Make a dedicated appointment with your doctor to discuss blood pressure targets. Not a quick mention at a routine visit. A dedicated conversation. Bring your 2-week blood pressure log. Bring your orthostatic test results. Bring your symptom list. And say this. Write this down. Doctor, I've been reading recent research from JAMA showing that for adults over 75, a blood pressure target of 130 to 140 may be safer than targeting below 120. I've checked my orthostatic blood pressure at home and found your results. Can we discuss whether my current target is right for ME specifically? That one statement changes the entire dynamic of the conversation. You're not arguing. You're not being difficult. You're being an informed participant in your own care. Action 6. Never, ever adjust your medications on your own. I want to be clear about that. Changing blood pressure medications without medical supervision can be dangerous. But asking your doctor to reevaluate? That's not dangerous. That's smart. That's advocacy. Action 7. Reassess every 6 to 12 months. What's right for your body at 72 might not be right at 78. Your needs change. Your medications might need to change with them. Now I want to hear from you. Comment one of these 3 things. Comment testing tonight if you're going to do the orthostatic blood pressure test at home tonight. Comment talking to my doctor if you're going to bring this information to your next appointment. Comment sharing now if you're sending this video to someone who needs to see it. I read every comment. And every time someone writes testing tonight, I know that's one more person who might prevent the fall that changes everything. One more person who might not become the next James. Here's what you now understand that most people, including many healthcare providers, don't fully grasp yet. You understand that blood pressure targets should not be the same for a 45-year-old and an 85-year-old. You understand that for adults over 75, systolic blood pressure between 130 and 145 is associated with the longest survival and best quality of life. You understand that pushing below 120 increases fall risk, kidney injury, and may accelerate cognitive decline. You understand why seniors need different targets: stiffer arteries, slower baroreceptors, altered medication metabolism. You know how to test for orthostatic hypotension at home. You know the warning signs that your pressure might be too low. And most importantly, you now have the knowledge and the language to sit across from your doctor and have a real conversation, not a passive, okay, whatever you say conversation. A conversation between 2 informed adults working together toward the same goal, keeping you healthy, independent, and safe. You are not a number on a chart. You are a person with a specific body, specific conditions, and specific needs, and you deserve a blood pressure target that reflects who you are, not a one-size-fits-all number from a study done on people half your age. If this video gave you clarity, if it gave you confidence, if it made you see your own health differently, then comment informed and empowered, because that's exactly what you are now. You're more informed about blood pressure management than 90% of people your age, and that knowledge is power. Use it. Now, in my next video, I'm going to tackle something that goes hand in hand with what we discussed today. I'm going to reveal the 4 foods that research shows can naturally support healthy blood pressure in older adults, and the 3 health foods that millions of seniors eat every day thinking they're helping, but that are actually making blood pressure worse. One of them is going to shock you. It's in almost every heart-healthy diet recommendation, and the science says it might be doing more harm than good for people over 70. Subscribe so you don't miss that. Tap the bell, and I'll see you there.